Good evening. I'm Anna Tragesser. I am the Director of Community Impact and Strategic Investment at Indy Arts Council. And tonight we're joined by three guests and to discuss health insurance and wellness support for artists and arts workers. In a moment, our guest speakers will introduce themselves. But first, I'd love for you to meet Judith Thomas, our President and CEO.
Hello, everyone. I am Judith Thomas, President and CEO of the Indy Arts Council. Really honored to be here with you today. Indy Arts Council knows that health insurance is a challenge for independent artists and small nonprofits. I mean, it's a challenge even when you have insurance, right? Navigating all that, and we don't have the silver bullet solution. Well, at least not yet. We plan on trying to get one. We are working hard to get that. But in the meantime, Indy Arts Council will connect our arts community with existing local resources that can make a big difference. And we want to continue to be resourceful for the entire arts sector. We'll continue holding space for learning and conversation about healthcare and resources. We are continually learning and exploring how Indy Arts Council can leverage its voice and its power and influence to make a difference in these health insurance challenges. So we truly appreciate you all, and the discussion is going to be wonderful. Anna will share more about the Freshbenies program, which is a brand new wellness resource for artists and for art workers that Indy Council will begin offering in April. So we truly appreciate that you are all here. We hope you leave this webinar feeling just a little more clarity and confidence to find affordable quality, right? Healthcare. So thank you all for being here.
Thank you, Judith. All right, well, let's hear from our panelists. So Dianna, Shawna, and Dylan, we'd love to hear from you. Introduce yourself and tell us a little about what your connection to this puzzle of healthcare or health insurance is, in whatever way you describe that.
Good evening. My name is Dianna Huddleston. I serve as the Vice President of Community Partnerships for Aspire Indiana Health, which is a federally qualified healthcare center. So I think that my part of the puzzle is that our mission is to serve everyone. We take all insurances, no insurance, Medicaid, Medicare. We have sliding fee scale. We don't turn anyone away. And we're not the only entity that does this type of work. So I want to help describe to you how to get connected to Aspire and other facilities that do just like what we do.
Awesome. And I'm Shawna Lake. I'm founder of Deep End Talent Strategies. So we're a human resources consulting firm, and we work with nonprofits and small companies. I've been in human resources for 26 years. So my piece of the puzzle is often helping small organizations or sometimes independent contractors who don't think they have access to health insurance, may have some limited options, and trying to figure out how to bring other partners to the table, like Dylan, like Dianna. How do we solve for that for employees or for contractors? And then when individuals have questions or they get these mysterious bills or EOBs in the mail and they freak out, I like to help them kind of walk through that from the employee relations side.
And my name is Dylan Melling. I am the practice manager at Integrity Benefit Partners based out of Indianapolis. We're an independent brokerage firm that helps both individuals and companies figure out how do you access health care. And we'll talk in a little bit. I'm a big believer in the idea of health care and health insurance being two separate ideas. And the more conversations you have around that and you can wrap your head around that, it makes the whole process just a little more manageable. It's still a lot, but it can be a little bit easier to deal with once you start understanding some of those concepts.
Thank you all. So tonight we will get a little bit of a refresher course, I guess, or maybe even an intro course, very, very intro on health insurance and the healthcare resources available. But we'll also understand a little more about the biggest challenges for health insurance and healthcare in 2026, how to find affordable and quality care, and then we'll also take some time to learn about a new resource from Indy Arts Council called Freshbenies. This webinar is being recorded and it will be emailed to all registrants of tonight's webinar. It will also be posted on our website at indyarts.org/wellness. And that webpage also has several other resources that we may reference today and information about Freshbenies. So please feel free to use the Q&A function in Zoom. It's probably going to be the easiest way to drop all of your questions about insurance or anything we're talking about. If you don't see that in your Zoom, you can use the chat, of course. We will pause a few different times throughout tonight's discussion to answer any questions that have come up. So let's zoom out a little bit. And Dylan, I think this is one thing that you seem to be very passionate about talking about. So tell us, why is health insurance even a thing?
It's the $1 million question for a lot of us right now. And just like a lot of things in America, it started because of money problems. Back in 1929, Baylor Hospital Systems down in Texas was having an issue during the Great Depression where they had many people coming in receiving services that could not afford to pay their bills. And the hospital system, up until that point, there was not this idea of health insurance, discounting, etc. If you went to the hospital, you just got a bill and you paid the bill. And that was your family's responsibility to handle. But as cash flow tightened on the American families, they found that more and more people were unable to pay the bills for their services. And so somebody had a great idea down there in Baylor that said, hey, if we could partner with someone and get consistent revenue in some way, then we wouldn't be worried about chasing the individuals for these payments. This was born out of a relationship then with the Dallas Teachers Union was the first entity to offer a health insurance product, which was for 50 cents a month. Any of the teachers that were covered by this policy then could go into the hospital and have their bills paid when they went in to the hospital at that time. That is the first sin that spawned all of the mess that we all deal with today in a lot of ways, was a revenue stabilization moment for a hospital. And so a lot of times people talk about and act like health insurance and health care are two opposing entities that fight each other all day long, when they were really born out of a need of one side trying to find cash flow stabilization and made up this system. The next big moment that we talk about a lot is in the 60s with the Medicare program that became very common across all the nation, covers individuals typically 65 years of age and older, when the government really got in the middle of insurance programs and hospitals and inserted themselves in that manner. That created a lot of the things that also irk us today, of things like improper documentation denials and things like those. A lot of those programs that bug us about regular health insurance today are also born out of how Medicare is administered. And that became kind of the framework that everybody else in America now looks at and says, Medicare does this, so I'm going to do this. So those are the two big things I always highlight for everyone. We talk about, why does health insurance even exist? Those are really the two most important moments in American history of how we ended up where we are today.
And it just gets simpler from there, of course. But of course, I am not a healthcare or health insurance expert, but I feel like over the last few, I don't know, maybe 10 years, I have had to sort through what some of these terms and words mean. It's really, I feel like it's taken that long for me. And so I've thrown a few of these common terms on this slide and also another slide after it. So hopefully I have described them correctly, but this will be a great learning experience for all of us. If anyone has a correction or an adjustment to how things are being described on the slide. Some of the most, some very common and it's what seems like foundational concepts of what we talk about when we talk about insurance, when we encounter health coverage conversations. But Shawna, based on really, I mean, if it's something that you see here or not, and you don't have to go through every single one of these, but what are some common questions that you might get from someone who's encountering health insurance, maybe for the first time?
There are a lot of common questions, and I think if this feels confusing, any of it, you're not behind and you're in very good company. First time consumers struggle with this, and sometimes even those of us that have been doing it for decades struggle with it. And it's not math. Sometimes it is the vocabulary of it, because insurance isn't intuitive, but it is something that we can learn by understanding some of the vocabulary. So I love that you put this together, Anna. Think of health insurance as more like your car insurance and risk management. So you have car insurance, but you still have to pay for gas and tires and preventative maintenance on your car. Just because you have car insurance doesn't mean that operating your car is free, right? I think sometimes people think that when they have health insurance, then medical care is free. That's the biggest question that I get from usually early entrance into the workforce. They'll say, I paid for you, I have health insurance because you take it out of my paycheck. So why am I getting a bill? Or why do I have to pay something when I go to the doctor? So I use that analogy that you hopefully also, if you have a car, have car insurance, but you still have to pay for the gas and the tires. So it's similar to that. So you still have to pay for the premium that if you are getting it through your employer is coming out of your paycheck. And then you have to pay the copay when you go to the doctor or the emergency room. And then you have the first amount that of your portion that you pay each year is your deductible, and then your cost sharing until you with the co-insurance that you and the insurance company are paying together until you hit that out-of-pocket maximum. So there's a lot of that education that needs to happen, but sometimes even a refresher for some of us who maybe have had a few healthy years, and then we have something happen. And there's a statistic, is it, Dylan, 1 every 5 years we're probably going to have a rough year, once every 5 years we're going to have an unhealthy year.
Depending on what you read, it's about once every 5 to 6 years, and that number is unfortunately shrinking. And that's how often does somebody even hit their deductible on the plan that they have. So for a lot of us, we don't deal with it most years, but when you deal with it, it gets very confusing very fast.
Yeah, I even had a procedure recently, and she said, this is at check-in, this is your obligation, can you pay this today? And I was like, oh, mentally we had not prepared to do that. And then I said, I guess. And she's like, okay. And she just looked at me. I was like, oh, you mean right now? Like before I even go back. So even like the transactions are changing and how they do that. They want payment even before that procedure has happened. So the experience also continues to evolve on us. I think even regardless of our age, sometimes or how long we maybe have had experience with health insurance, we don't know that you can ask for health estimates before you have care. And you can ask if something is in network. And if you're having a procedure, the facility needs to be in network, but everyone who touches you also needs to be in network. So an anesthesiologist, the specialist. So you can go to have done your homework to get a procedure done in network. But if another specialist comes in that's out of network, they could try to bill you out of network. And then now you have to appeal that. And that's when it's really nice to be able to lean on your HR resources or your brokers or other partners that can help you do that, so you don't feel like you're in this alone. Or Freshbenies, if you sign up for that program, they can help you navigate through things like that as well. So you don't always have to pay the bills. I also get people who come and they get an explanation of benefits or an EOB and think that's a bill. That is not a bill. That is the insurance company saying, you're probably going to get a bill and it should match this. So then you can match the two things up. So if you get the explanation of benefits, then you get a bill, they should match. So that is a guide to help you make sure that you're paying the right amount. So I could probably go on forever. I'll stop there. And if you have any questions, you can put them in the Q&A, or we can maybe take them at the end. But there are a lot of things that continue to trip us up and that we're all still learning.
For sure. I just rolled through the second slide here too. Some other kind of common terms that we might get, especially around the type of plans we might be encountering or specific mechanics about how and when insurance or savings kick in. Anything, and anybody, Dianna, Shawna, or Dylan, anything even from some of these terms that become common questions folks you interact with.
One that I encounter a lot is on those bottom two, the differences between a health savings account, a FSA flexible spending account, health reimbursement account, depending on your employer setup. that style can get very, very confusing fast. The big picture idea of those is in some ways being able to pre-tax dollars that are being meant for healthcare expenses. And as a concept, that is awesome. Like that is really, really important for someone, especially someone who takes some medication that's $200 a month. Saving on the payroll taxes of that $200 a month, that does make that medication more affordable. That may be, depending on their situation, that may be a difference of 25, $30 a month very easily for some folks. That's awesome. However, a lot of consumers get tripped up on understanding the terms of what type of account they're in, eligibility requirements, and the right of who actually owns that money at the end of the day. Health savings accounts typically are going to be your property as an end consumer. That's your money, period. Flexible spending accounts are usually on a use it or lose it basis. And I've unfortunately dealt with a lot of people over the years that did not know about that. Sometimes you may have a rollover provision of some money that will keep on going, but that's all tax code. That's not your employer being mean. But that's just what the law says right now, unfortunately, is that is use it or lose it money. And that makes it very, very confusing. So we love the pre-taxability of some of that. But again, like Shawna was explaining, even if you're fluent in this, it can be easy to make a mistake. I question my own numbers every year when I'm sitting down and selecting my own plans and selecting how much I'm putting into my HSA. I question my own numbers, and I do
What do you
this for a
mean?
living.
What do you mean you question your own numbers?
When you're sitting down and figuring out, okay, I think this plan's the better fit for me this year versus this plan. Okay,
Mhm.
this one costs this much versus this much. How much am I putting into my health savings account? It can be a lot to keep in front of you, even if
Yeah.
you're confident in what you're looking at.
So you actually shop around every year, or you kind of like confirm your own choices every year and think about what your and your family's specific health needs are in that year and if you have the right plan. Is that right?
Yeah, because just like many people on this call, I am not covered by a group policy through an employer. I work for a three-person firm. We just don't have the need to have a group policy at this time. So I buy policies on the individual exchange personally. And so when we'll talk about some of the where to get health insurance at, I'm living the example there. I log on to healthcare.gov every year myself and look for my own family's policies. So, and that gives you, if you're in Marion County, that will give you an option of up to 106 different plans to choose from in 2026. Way too many plans, way too many just slight variables that make it 10 cents more here, $2 less over here. It can be overwhelming, even for someone who looks at this kind of stuff all day long.
Well, about what time of year do you usually start thinking about that? Because there's some like time frames we need to be aware of, right?
There are, and we have the note on here about open enrollment, typical timeframes there. Your employer, if you're getting coverage through that avenue, will set that. For a lot of employers, that will be a time frame somewhere between October to December. But there are plans who have off-cycle renewals as well. They may have open enrollment in June, July, August, March. It can be all over the place. That's for that avenue. For people who get their own individual coverage, your prime time is really from November 1st to December 15th.
Mm.
There's a little bit of flexibility for a later start date after December 15th, but that December 15th is the big date for a lot of people. And individuals who are covered by Medicaid or Medicare, the over 65-year-old program, primarily, are going to be looking at an even shorter window than that because their open enrollment window stops, I believe, December 9th. Do not quote me on that one, please. But they stop even a few days earlier than the ACA open enrollment window.
Okay. Well, I want to flip back actually one more slide. We chatted, maybe even before this call, we chatted a little about pre-existing conditions. What should we know? What is that? What are they talking about, and what are we supposed to do with that information?
Yeah, so a pre-existing condition as a concept means that you have something medically in within yourself that is a known reason that you could incur future medical bills. So an example very often is someone who is diabetic. and they're type 1 or type 2, doesn't matter, but they know they are a diabetic. They likely take insulin, metformin. In this day and age, they may be taking a GLP-1. They may have continuous blood monitors with the Dextera and some of those products. They know they have ongoing costs. The existence of pre-existing conditions in the current legal setup is much more manageable than it did used to be. That is a good thing. That right now with the Affordable Care Act and the ACA compliant policies through health exchanges, through direct contracting, those ACA compliant policies do offer more coverage for people now. It does not impact that you have to pay more deductible because of it or whatever. So that's positive. On the potential downside is that people with pre-existing conditions probably need to just pause a little bit longer than some other people when they are shopping for available policies. There are some policies, for example, United Healthcare has a golden rule policy that you will find ads for very fast online if you start searching for this stuff. There are still policies you can purchase that do not cover pre-existing conditions. They are harder to come by today than they used to be. There are also things like health shares, health ministries. You'll see those labeled quite a few different ways. For some individuals, it might be a fine fit, but for someone with a pre-existing condition, you need to understand your contract language very, very well about what you're purchasing then and what exposures you may have. If you buy an ACA compliant policy, it doesn't matter if your pre-existing cancer ends up having $5 million in claims that year, it has to pay it. Outside of those plans with those ACA protections, you may have some liability there, and that's important to understand.
If I could just add, I do see people who have feel that great amount of relief that their pre-existing conditions are not going to be an issue on a health insurance plan. That same ACA Affordable Care Act provision does not extend to short and long-term disability plans. So if you maybe have a new job, which is exciting, and finally you're going to have like disability coverage, there could still be pre-existing condition clauses on disability policies. So it's important to know. And I see that come up in pregnancy a lot. So they're often shorter term conditions or situations, but still can take people by surprise.
So what I'm hearing is there are options. We have to do a little research and make sure that we're reading everything and probably also asking questions about things we don't quite understand in those policies to make sure that what we're choosing to opt into or the options we have to opt into are actually going to be a fit for our life and what's going on. Is that about right?
Perfect.
Okay.
Absolutely.
Well, let's take a pause. Lauren, I want to check in with you. Have we gotten any questions we need to answer?
I'm not seeing any questions in the chat or the Q&A, so I think we're good to move on.
Okay, great. Well, everybody feel free to keep adding those if anything comes up, and we'll continue to take a break throughout. All right, well, now let's talk a little about how does this work? Where and how does one get health insurance? Dylan, do you want to take a stab at this one?
I can start for sure because there are a lot of avenues someone can work through. The first and the most common one that covers over 100 million Americans is through workplace policies. So that's going to be one that your employer has picked out for you, and they may have one or two companies they're working with, and they say these are your usually one, two, three, four plans you can choose from. That is the most common answer for a lot of Americans right now if they are not on a government affiliated program of some sort like CHIP, HIP, Medicare, Medicaid, etc. If you're on one of those, the most common answer then becomes your employer insurance. And for those who are with us today that are plan sponsors, that are a business that is putting that on, that selection process can be its own beast. Are you looking at things like an ICHRA and helping your people buy individual policies? Are you actually selecting a group policy, self-funded, level funded, fully funded? We will never run out of jargon and terms in the health insurance world to confuse people. Unfortunately, that's one of the specialties of the entire industry. So that's avenue one. But for a lot of Americans, that one is pretty easy. That's just, hey, I know every year I get an email from Employee Navigator or Paylocity or whatever platform we're using, and it says pick out one of my options. I click a couple of buttons and it's done. Um, that's one option. Next one is for people who are in the more solopreneur, individual performers type of world, which is a lot of people that are affiliated, I know, with the Indy Arts Council. At that point, then we're usually looking more at considering first off, like Shawna was mentioning there, the ACA compliant plan. So you see on the slide here, the marketplace.gov is usually the starting point for a lot of individuals. So going on to healthcare.gov, searching on there and seeing what plans are available in your local area, that's a really, really important starting point. One caveat that I want to give with that one is that it's important to go to healthcare.gov. If you just type for health insurance, you will find a number of I'm not going to call them scam websites because they do tell you on there in the 4-point font at the very bottom, this is not official government stuff. But they're going to sell your information over 20 times over. We've all signed up for something in our lives that we had one of those experiences, I know. So make sure you're on healthcare.gov to look there. Some of the other resources there you see about talking to a navigator. These are people that are employed by the. Actually, I'll let Dianna go in on that. Do you want to share just touch on a navigators, because I believe the Aspire has navigators available to people as they're working through with your programs, correct?
We do. Thank you. And so a navigator is someone who's gone through training and they understand a lot of what Dylan's talking about, and different plans and how to connect with them and what you might be eligible for. And so and one of the things that Aspire offers is that we actually have navigators at our local clinics, and also we can connect you to a navigator. And that's part of the service that we provide so that we can help people get eligible for what they might be. Somebody might be eligible for Medicaid or Medicare and didn't know it. And didn't know how to apply, didn't know how to do all the things. They might be eligible for something that's in the marketplace. They didn't know how to apply. And the navigator is trained to help you do that. So you can connect with a federally qualified healthcare center or a community mental health center, which will typically have navigators connected to them. And that's just part of the service that they offer. Or you can go look to talk to a professional navigator, and there might be a fee with that.
You know that you saying it that way makes me want to highlight something that maybe we've taken for granted up to this point in understanding. So I've referenced a couple of times the government affiliated programs that we have, which are Medicare, which primarily serve, not exclusively, but primarily ages 65 and over. That's one avenue there that, again, a navigator or a broker will be able to help you identify should you be looking at that bucket. Medicaid, on the other hand, is a program that's primarily designed for low income individuals, low income families, children in certain states. And on the Medicaid side, that is a different application process. But to Diana's point, a lot of people are actually qualified for those programs and just don't realize it. And I'll be one of the first people to tell people that if you qualify for one of those programs, that just may make more sense for your household than paying for an ACA policy, an employer policy, etc. Now we're going to catch up in a minute about some changes that are occurring in that world, and there are some important changes that people need to be aware of. But that is an important thing to make sure that people understand that those are options that cost very little to nothing to the individuals very often compared to a private healthcare plan they have. So,
Perfect. Anything else you want to share about how to connect with health insurance plan?
yeah, only other one that I want to really highlight on is that third slide about insurance broker. I obviously I work as I don't use the word broker very often. I usually use consultant, but tomato tomato. I realize for sure to a lot of people, right? Um, Working with a broker can be a fantastic experience. Just make sure that again you're understanding what products and what policies are they presenting to you and why. Um, some people, again, those short medical plans, those health shares, that might be an okay fit for you in your situation where you are in life. That might be okay. And that might present some significant savings to certain individuals over a healthcare.gov policy. But just again, ask questions. You are empowered in this process to ask a lot of questions of all of us there. They do offer some great insights. Like I share the example often in the state of Indiana. If you go on to healthcare.gov and you look at the policies, a lot of Hoosiers select an Anthem plan because Anthem is a big logo. Most of us have had it through an employer at some point. But Anthem in the state of Indiana on the marketplace policy is not the big Anthem network that you're probably used to. And a broker should be able to help you walk through that conversation and understand, hey, yeah, this policy maybe doesn't make sense for your family because your doctor's over here. Don't just assume they're in network because they were in network with a previous plan with that same logo. And they can give you insights like that.
I'll be the one here to ask what might feel like a dumb question,
Yeah.
but can you talk to an insurance consultant like just to try to work through those questions? I mean, I may not be an employer, I may be someone who's self-employed and has a family or not, but how do I even, how do I approach, how do I find that person and like what kind of questions am I supposed to ask them?
For my side, I would recommend that somebody is considering who do I want to work with, who and do I want to just ask a few questions. Most people in the broker space are pretty happy to answer a couple of questions. They just say, "Hey, I'm thinking about this. What do you think about this?" That's usually not that big of a drag for people. Um, there is a point where they might say, "Hey, I want to actually work with you and make sure you're a client of mine to formalize this relationship." When you're working through healthcare.gov, the agents don't charge you additional money because we receive compensation through the healthcare.gov policies, and it doesn't change your pricing. That's one of the biggest tricks that everybody pulled is that the pricing stays the same whether you get help or not. I don't know where the money goes when you don't get help. Nobody's ever answered that for me still. So it goes somewhere, I assume, but that's available for you out there as well. So you see the resources here about localhelp.healthcare.gov. That is a list of agents who are in, you can search by zip code, you can search by several different criteria, and you can filter through and say, okay, this is who I want to work with and why. And those are agents who have self identified and said, hey, I like selling marketplace plans, I like serving individuals. Please call me.
Beautiful. Thank you. I appreciate that.
Yeah.
Well, let's talk just briefly. You mentioned we've been alluding to some changes in the health insurance landscape, and part of this has to do with Congress. Part of it has to do with the economy, right? But can you just give us the kind of like first grade version of it, the really high level? What do we just need to know about these changes?
I would say, especially for a group here based out of the greater Indianapolis region, especially here, there's been a really, really big shift with Indiana Medicaid over the past several years. During the pandemic, a lot of states, and Indiana included, loosened up a lot of the verification steps for a little while. And that was partly just logistically that people were figuring out how to work remotely, as we all probably remember. Um, and now that for every action, there is a reaction, as happens in life. And so, just this last week, the Indiana House and Senate and the Governor Braun passed a new bill that has several new verification steps for individuals who are looking, especially at the Medicaid program. So that's going to impact HIP and CHIP, which are both programs that people pay just a few dollars a month to participate in, but give them a sort of Medicaid light program. They still can be much more affordable for a lot of folks over a marketplace plan. On that side, the biggest change is re-verification every 6 months. So if you're on Medicaid or one of those auxiliary programs, you now need to be prepared, not just an annual recertification like the law had been previously, but now every 6 months. And we unfortunately see a lot of individuals who were on Medicaid, moved, did not update their address, and lost eligibility. And they don't find out they lost eligibility until they're standing at the doctor's office, until they're standing at the pharmacy counter. And that's the moment they find out they're no longer covered. We see that terribly often, unfortunately. So that is a really, really important change that we're trying to let people know about, that this is impacting a lot of lives in Indiana. And it just got signed into law. So it hasn't started yet, but that's happening soon. And we're encouraging people who rely on those programs, make sure that you have clear path of access on updates with your coverage and et cetera, because that's going to impact a lot of people. The other biggest change that's happened lately that I think impacts a lot of individuals on this call is the marketplace premium enhanced subsidies that are available. So an individual who goes onto healthcare.gov is able to put in some basic information about their income, and at certain income levels, as a part of the Affordable Care Act, we've decided as a society that we'll say, hey, we will cover part of your premium for you. So instead of the sticker price of your premium might be $500, but we're only going to ask you to pay $80 of that a month, and then the taxpayers will take care of the rest. That is implemented through tax credits. So if you lie about it on the front end, and then you go to do your taxes, and right about this time of year for everyone every year, you can get a really, really, really nasty surprise when they say, hey, give me all that money back because you lied egregiously about what you did there. Not as common, as long as you're honest about your income, it usually works out fine, but that is a significant thing. But again, during the pandemic, there was part of the American Rescue Act was giving enhanced subsidies to a lot of individuals. And so not just people who maybe feel like, yeah, I probably should be qualifying for some help, but there were a lot of families who, in my experience, said, I don't feel like I'm in that income bracket that I get help, but I'll take it if it's there. And that was what the law was. That unwound through this 2026 year now. And so now we're back to what the subsidies were before. That had a couple of impacts on pricing, as people were used to larger enrollment numbers for a couple of years. And larger enrollment was primarily driven by just free money being available to help make it more affordable. And when it disappeared, the enrollments tampered a little bit. And we're seeing some of that data play out now as we're getting several months into the renewal season now, and policies that have binded and seeing what that looks like. So that did impact some other people, especially again on that solopreneur, on that individual who doesn't get coverage through their employer. This had a big impact on people. And so making sure that if you're someone who is receiving those premium tax subsidies, making sure that you keep your income up to date on those websites is critical. I encourage my clients, if you're taking the tax credits, log in every 3 months and just make sure if you had any kind of lifestyle changes, if you got a raise, if you got a new job, update it during the year, because it's a lot easier to update it and adjust then instead of waiting until tax time and look back and try to get all that money back then.
Okay, so pay attention to some of the requirements if we're on the Healthy Indiana plan, or which is HIP, or Children's Healthy Indiana plan.
Yeah,
Is that what
CHIP.
that acronym
Yeah,
stands for? CHIP.
children's.
And then also be aware that marketplace insurance may not be as affordable as it used to be. Am I summarizing that right?
Yeah, and there's still subsidy available for individuals out
Mhm.
there, but it's not as rich as it was a couple of years ago. I think that's the fairest
Okay,
statement.
thank you.
Yeah.
Thank you.
Yeah.
Okay, well, let's talk a little about what if health insurance is not an option for me right now, for whatever reason, or if my costs are still quite high. Dianna, can you tell us about some of the options to receive quality care, with or without health insurance?
Absolutely. So, like I mentioned in my introduction, I'm going to use my own company as the example, but there are many, and you have some links on the next slide. And I know that Anna was putting these on the website as well. But Aspire Indiana Health is a healthcare system, and we can be that because we have two designations: the designation by the state of Indiana as a community mental health center. So we do behavioral health for all ages. So you need a therapist, you need a therapist for your child, you need addiction services for your neighbor, right? Like, so all of those things can occur and a community-based mental health center. And because we do get funding for the 6 counties that we serve, and any community mental health center would have this same setup, we get some county funding, we get some state funding, there's some federal funding. So our mission is to serve everyone and to serve the safety net population, which would be people without insurance or without fully being insured, people who have Medicaid, Medicare, HIP. We accept all of those, CHIP, all of those insurances. Secondly, we have the designation as a federally qualified healthcare center. And so that means that we're getting federal dollars and to be able to do primary care. So we can be someone's medical home, right? Everybody needs a doctor that you call when you have a sinus infection, that you call when you think you have this weird thing growing on your arm, right? Like you need a doctor because none of us should be using emergency rooms as our primary care, right? It's expensive. It it puts other people in danger, right? Because now they're working with us, and now they have an ambulance coming in, someone who's had an accident, and they need this immediate kind of care, and so we need to have a medical home. That's what we call it, is having a medical home. And again, because of that funding, we're going to serve everyone, take all insurances, Medicaid, Medicare, HIP, CHIP, and we're not going to turn anyone away. You could talk with our navigators. You can do a sliding fee scale. We can set up a charity care if the sliding fee scale even doesn't work for you. And so we're going to find a way to serve you and be your provider. So in central Indiana, think of places like Adult and Child in Indianapolis, or has the same designations that Aspire has, or Meridian Health Services, Eskenazi, right? And so you have choices of places that you could seek this kind of care out. And it's really good care. And really, federally qualified healthcare centers are the largest primary care systems in our country. They're seeing millions of people every year, and families. So children can get their vaccinations and their school physicals, sports physicals, all those things. At Aspire, we also operate our own pharmacies so that we can pass on the discounts that we get to our patients, and so that they can get pharmacy medications at a much discounted rate in many cases. We are now offering specialty care in rheumatology, dermatology, neurology, so that if you needed those specialty cares, you can get them right at Aspire. It's important that you think about having a place to be able to get your health care, because healthcare is not just when I'm sick, it's also about prevention, and it's about regular ongoing care. We all should be going to the doctor a couple of times a year for just those normal checkups, making sure that everything's going well. It also gives you a baseline of to know when things are not going well. And when you have a better sense of your health overall, then you can manage that better. It also helps you to be an informed consumer. And so that you can make good choices, and that if you get told something really strange, that's not right. I'm going to give you a really quick example. I have a special needs son that I adopted when he was 4 years old. And so from the time he was 4 years old, he went to the dentist every 6 months, right? He had a full set of braces. We took care of stuff. I knew his dental history. All was good. He became an adult. He and I made a decision for him to move into a group home situation, which has been a great situation for him. They took him to the group home dentist. the first thing call I get from the staff is Kenny has really bad teeth and he needs all of his teeth capped. He sure doesn't. Right? There was a bad actor out there, and was going to take advantage, and that didn't happen. And I don't know that that guy has his license anymore because unfortunately Kenny's mother knows a thing or two. So, but that's what it's about, being an informed. That's a really, big example, but being informed consumer, right? If you know your blood pressure and you're taking your blood pressure regularly and you know what's going on with you and yourself and your family, then you can't have somebody telling you something that's not right, or you can make a better informed decision. And that's all about preventative care. And that can happen for you regardless of your ability to pay or your insurance if you are choosing to connect with a federally qualified healthcare center in your area.
This is great. Does anybody else have any other examples of what it means to be an informed consumer?
Well, Dylan,
go ahead, Diane.
I would just also say, like, think about prescriptions, right? Like, so your doctor or nurse practitioner prescribes a prescription to you, and that prescription's not covered on your plan, or it's not fully covered on your plan. And that may just be that they're used to prescribing that, they know that drug, right? But it's okay for you to say and have your information and be able to say, hey, doc, I don't know if you realize, but this would cost me $200 a month to get this. Is there something else that you can prescribe for me? Can we have a conversation? And they may say, you know what? No, like, you really need this. Or they may say, oh my gosh, yeah, let's look at some other things. I wasn't aware. So you have to be an advocate for yourself. And you have to be able to say, I can do this, but I can't do this. Things that your doctor says, I need you to go get an MRI. Please go to IU Health and get that. But my plan says I need to get my MRI at Riverview. That's where I'm covered. Oh, okay. Well, that'd be all right with me. You can go get your MRI at Riverview, but they're not going to know that unless you know it and you're able to speak up.
Yeah, you took the words right out of my mouth. That it's an important thing for all of us to realize: healthcare does not cost the same no matter where you go. The costs are variable across the board, and consumers who are more cash pay driven than insurance copay driven should be more acutely aware of that. That again, like Diana was mentioning there, here in Indianapolis area, I can get you an MRI for $350, or I can get you an MRI for, I saw one come through a couple of days ago, $4,100. Same machine, same imaging, either way. Makes a big difference in my pocketbook, depending on which of those prices I'm paying. And so if that's something that appeals to you, just again, like Diana said, step up, speak out there. Drugs, especially, that's getting so easy to fact check now about what that cost should be with resources like Cost Plus Drugs, Amazon, pharmacy. There are just several ways to be sitting there right in the office, just pull up, like, yeah, that looks like a reasonable drug, or whoa, let's talk about that price point for a moment, doc. And sometimes you do need the highest priced drug, but a lot of times you may be just fine with the generic or an alternative as a stair step approach to see, do I really need to pay 200 a month, or 200 a month is low on some of the costs of some of these medications, unfortunately, nowadays.
I would just also add that your time is valuable. So I have a primary care doctor that's in one major hospital system in town, and then I have an endocrinologist that's in another major hospital system in town, and their systems don't talk to each other. So when I get my annual physical once a year at my one doctor, they do a blood draw every year. And then my endocrinologist orders a blood draw every year. And for a couple of years, I was getting 2 blood draws every year. And then I realized this is ridiculous. My time is valuable. Plus, I have to pay because one's not preventative. So I just download the blood work from one system, upload it to the other one. It takes me about 2 minutes and it saves me an hour of driving around town and probably about $85 of the blood work fee. So it's not 350 versus $4,100, but my time is valuable too.
And your blood, Shawna.
And
Keep
my
that
blood. I'm keeping my blood.
blood.
I need that iron because I'm vegetarian. I got to keep all those
You
red blood
got
cells.
to.
Yes.
These are great examples, and I feel like that just kind of represents a shift for some of us who may have been socialized to believe that doctors know everything and we should understand, we should just believe what they're instructing us to do. And it's honestly sometimes we do want that too, right? Like sometimes it's scary situations where we don't have the bandwidth or the time to sort through all of those nuances. That's maybe always going to be a reality in some cases. Um, but especially in those scary situations, like, do you have any advice of just about like, I don't know, mindsets or tips or other assistance that can help sort through some of those questions and decisions?
You can always ask for a second opinion, right? And you can, just like you probably don't buy the first car on the lot, maybe you go to, 2 or 3 car lots before you pick out a car. You can also pick out your medical that way too, or the services that you're going to get. You need to make sure that you feel really comfortable, and that you also do your research. I don't want you to all become Google Docs, right? And go out and get your medical advice from Google. But shop around and then also make sure that you're informed. If they tell you some diagnosis you've never heard of, or some medication, there's plenty of ways for you to look that up and start to educate yourself enough to feel like you can ask questions.
And with that as well, again, being your own advocate, if you're being told, hey, something's terrible and we need to do this right now, that may be correct, but feel free to push back a little bit and understand better. A friend of mine had a significant elbow injury, and the time frame on what happened, it turned out, was you need to have that operated on within about 72 hours. So pretty quick acting response there. They went to the ER after the accident and they were in there, and the surgeon that was there that was like, hey, I'm ready to go, literally had just finished doing an appendix a couple of minutes ago. And they were like, hey, I just got done with this appendix over here. I'm ready to go fix up your elbow next. And that person said, I'm going to pause, and based on everything I'm reading and everything, it looks like I've got up to 3 days to get this done. Is that accurate? The doctor said, well, yeah, but like I'm ready to go, man. And they said, no, I'm going to go. And they went to an orthopedic surgeon for that, somebody who actually works on elbows for their whole life. And their arm works fine now. And it's not a guarantee that God bless the general surgeons. They matter so, so much. They really do. But if you just go into whoever's in, like you said, they're the first car on the lot. If you just go to whatever's right in front of you immediately, it may not be the most specialized fit. It may not be the proper fit for your situation and what outcomes you care about. And I have another friend who had one of those emergency surgeries, and their outcome was not as pleasant as what the other person had. So just advocate for yourself. And doctors know so much. They are incredibly important parts of the system. We need them. We need doctors. But you also matter in the equation too. And don't give up your right to ask your own questions.
Thank you, Dylan. Let's talk briefly here just about some alternative models to in health insurance. I'm learning a lot, mostly from Dylan, about some other structures maybe they've always existed, and also some of them are kind of evolving. So we're going to talk about Freshbenies here in just a second. I think this is one example of an alternative
Yes.
product that can help keep the cost of care down. But Dylan, can you tell us about MIWAs and direct primary care? What are these?
Absolutely. So NEWAs have been around for a while, and that is the idea of a group of people joining together underneath one umbrella for an insurance policy. Benefits of these are that, well, it's both a benefit and a downside. The benefit is that on the MEWA side, they have the right to turn down applicants. By retaining that ability to turn down applicants for those to get approved, you very often can find lower priced health insurance solutions than you may find in other avenues that have to say yes to everyone. That can be a good thing, that can be a bad thing. I am happy to talk through that with individuals all day long. I think it's a worthwhile conversation. But this is something that's available for primarily employers, typically are the main driver of that. I know that we've been exploring some MeWall like endeavors with the Indy Arts Council over the past coming up on a year now. And that may be something that comes to fruition down the road. But primarily, MeWAs at the moment in the state of Indiana are really targeting employer groups with at least two separate households being employed. So it's not a husband and wife together, and that's not the employer group there. Um, there's one that just opened up recently for that's really focused on Indiana nonprofits. The caution I would give any employer who's exploring these is just because it's a product that says it's made just for you, validate that price point against other opportunities that you may find out there. Validate that against I referenced it earlier, an ICRA model, which is where you're giving some money for your people on a pre-tax basis to help them purchase healthcare.gov policies. That can be a wonderful tool just to spot check, hey, what's this price versus this price? Because sometimes I have seen me wall quotes to come back and I roll my eyes at them and I go, I'm not putting that in front of anyone. That was awful. I get some of those proposals back for some of our groups, unfortunately. So fact check that. Next one, alternative model, direct primary care. This is exiting the health insurance world primarily. This is back to that health care world. And so Diana shared a lot about the great facilities that are available there through the federally qualified locations and everything. This is another take on that. This one's going to be a bit more cash heavy for an individual, but for some individuals, that's what they want to do. They want that kind of, it may be called concierge doctoring in some areas, but this is going to be more of a one-to-one panel with a much smaller group of patients that a doctor or nurse practitioner is managing within their book of clients there. A lot of these are usually ones that will cover a lot of things that you have a copay for as part of their subscription model. And instead of paying a variable each time you use it, it goes up and down maybe based on what tests we ran or whatever. They may just say, hey, for $80 a month, just like a subscription service, you're going to have access to me as a doctor. A lot of those include things like, hey, text the doctor whenever you have something going on there, virtual visits with your doctor there, a much longer intake appointment than you're typically used to. They may do stitches for no cost when you have something like that happen. They may include medications for you at no cost. There are a lot of perks that can make it really enticing for some individuals. My own family used one of those, even though again I talked about I use healthcare.gov for my health insurance, but I use a direct primary care doctor for the health care of my family primarily. And that ability to have that doctor that responds quickly because they just don't have as many patients and they're not dealing with insurance companies all day, that can be valuable. When my wife had a concussion, we used the direct primary care as a quick spot check for, hey, this is what happened. Here's where she's at now. Do we need to go in or are we okay? And I say if mine responds within a couple of minutes, we'll stay. If not, then we'll just go ahead and head on in. Called us immediately after that text was sent. Said, "Hey, can you get on FaceTime right now?" Yep, and it's not actually FaceTime; it's a HIPAA secure FaceTime. But so we hit the button and we get on FaceTime with her, and she goes through. And unfortunately for me, the answer was go into the ER. Um, but that ability to talk to that doctor is the difference between like an automatic ER bill or not potentially there. And that's a powerful moment for a consumer to have in the system where a lot of times we just feel like we just got to go wherever. A lot of DPCs will typically engage with you more and help you consider some of those questions. So those are two really popular, or really three between the MIWAs, the ICRAs, and the DPCs. Those are three really popular alternative styles of care and coverage that we're seeing Indiana people really take up right now.
They're great examples. Thank you.
Yeah.
All right. Well, we're going to shift into talking about Freshbenies in a moment, and then closing up in the next 5 or so minutes. But Lauren, I want to check with you. Any questions we need to follow up on?
Still not seeing anything, but I'll keep my eye out.
Cool. All right. Everything is perfectly clear or super overwhelming. Well, let me flip back for a moment and we talked a little, just briefly, we touched on Fresh Bennies as a possible tool that could help us control our costs. And so what's happening here is that Indy Arts Council is using Fresh Bennies as a complement to some other, benefits that our employees have. And we have the opportunity to open it up to arts workers and artists in Central Indiana to also take advantage of. So, Indy Arts Council is starting today, allowing any arts worker and artist in Central Indiana who is over 18 years old and can provide an identification number the opportunity to opt in to this service. And what it is, I think to me, it falls within this like prevention and cost savings category. It provides virtual care with a healthcare provider, 24/7, 365 access to be able to get in touch with a provider about questions, common cold, I'm feeling weird, I might need a prescription, to be able to check in with them and get problem solved or determine what's next. It can also include behavioral health, so therapy, right? And physical therapy if that's something that's needed. And it can also include that ongoing primary care, that like healthcare home type relationship that Dianna mentioned. It also includes discounts for dental and vision as well as prescriptions. So that kind of thing where maybe you really do need to be using the prescription that feels like an uncomfortable amount of money to refill. Something similar to like a good RX situation that helps bring those costs down to zero or at least adds on quite a lot of discount. My maybe like right now, my favorite thing about this is the advocacy aspect of Fresh Bennies, which, and Dylan, please jump in and would love some examples too, as you've had other clients and customers use this service. But the advocacy experience being a person in a service who can kind of sort through the mire of healthcare bills or referrals or services that we might need to find but don't know where the most affordable option is or don't even know like where the how to sort through like a handful of bills that we just got, right? I had to get some imaging done a few months back and had the same situation where I was either going to get it right at the local hospital, which would have been convenient, but it wasn't an urgent situation. And I am learning now that I can shop around, and so I just started doing some Googling, right? But I that feels a little overwhelming to me, and that would have been a really helpful moment for the advocacy service to be able to get in touch with them, help them understand what my insurance coverage would be, and then allow them to do some of the shopping for me while I can focus on maybe some other urgent issues in my own life. Um, Dylan, am
And
I describing that?
you are describing it spot on. I'll share again. I'm such a terrible poker player. I'm an open book with a lot of this stuff here. With Fresh Minis, I've used it myself for several years, and it's been a great impact for my family. We were looking for a specialist for one of my daughters with a genetic condition that I needed to find a certain style of doctors doing a certain thing. But one was also having to take pediatric patients, which most for that, when you look at that condition, most of their patients, it's more geriatric focused, is what they were out there for. And so I called my advocate and I said, hey, this is what's going on with Maggie, and this is what I need to help finding here. They actually spent the time and we worked through and they say, okay, this is your insurance coverage. Yep, here's my network link. Okay, they went through and they started calling offices. And I got a report several days later with, hey, here are three different offices that do serve pediatric patients that have openings. Here's the name of the person I spoke to at that office. And here's the next appointment you could take over there. Do your own research on these three. Like it's not necessarily saying these are the only options, but they did a lot of that blunt work for me of just calling, hey, what do you think? Nope, okay, next they did that for me, and that was incredibly valuable service to my family, who I tried, just because I am who I am. I tried to do a little bit of it on my own, and I got so flustered that I said I need to let an expert handle this, and they did. Other examples, if you don't have other health insurance, they may direct you to a federally qualified health center. They're going to know about those opportunities to find great cash pay. They're going to know how to navigate the system and help you out there. That advocacy program just can be significantly relieving when you're dealing with a medical situation mentally for you.
I'm starting to process this service as almost like that first level filter of, where I can get primary care or help myself be a good consumer by knowing my own health and kind of taking care of myself in that just like prevention area. But then also, um, when I do encounter something else, somebody who's like with me to kind of sort through what's next, whether I have insurance or not, just at least cut through the first level of crap or of frustration that you might experience when you're using some different levels of the healthcare system. So this is, like I said before, this is a service that Indy Arts Council is just able to extend to the rest of the creative community pretty easily. And so we're offering two different options in this. Basically, this is something we're offering at cost to the community. So if you check out indyarts.com/wellness, you can learn more about Freshbenies and kind of the two different package options that we're offering. It will be a monthly subscription, either $20 a month or $38 a month, and something you can, it doesn't belong to your job, right? Like you can use it whether or not you have other health insurance, or as your other employment or life situation changes. And it also, one subscription extends to your spouse and your tax eligible dependents. So your household is covered with one subscription, can use these services there.
Yep.
All right. Well, here's what's next. We've shared a lot of information tonight, and like I said, this is being recorded and will be posted on indyarts.org/wellness. But I tried to summarize, like, if I am trying to sort through what my next steps are about finding care, getting affordable care, my first step might be maybe walk through the doors of a federally qualified healthcare center and either get connected with a navigator and see what my options are, or get set up with the care I might need immediately. If I'm an employer, if I want to explore other private health insurance plans, I can do that with a navigator or with a broker consultant. There's a few different databases that you can start shopping around if you want. If you're an employer, you might want to just kind of be aware of and check out options of multiple employer welfare agreements, those MIWAs that Dylan was talking about. There are two that we're aware of right now in Indiana: Chamber Care, which is offered through Indiana Chamber, or Indy Chamber. Actually, Indiana Chamber also has options for outside of Indianapolis. And the Indiana Philanthropy Alliance, which is that new nonprofit MIWA that Dylan mentioned. It is brand new. There's no details on it yet, but just pay attention to Indiana Philanthropy Alliance, and I'm sure they'll be releasing more information soon. And then I just would encourage you to check out Freshbenies. I hope we've intended for it to be a useful resource to our entire creative community, and would love to hear any feedback on if it feels like a good fit. Please feel free to reach out to me or my friend Lauren here, who's on the call. You'll find her contact information at indyarts.org/wellness, that page we've been referencing with all this information. And we just appreciate your willingness to learn and to keep in this conversation with us. We're going to continue to talk more about healthcare and health insurance because this problem will be around for a while. So let's keep talking about it, becoming more comfortable with it as we look for more solutions for our creative community. That's all from me tonight. I will certainly stick around if there's any other questions that come up in the chat, but I just want to thank Dianna, thank you, Shawna, thank you, Dylan, for spending the evening with us, just talking through some of these confusing and tough concepts. We appreciate you.
Thank you for the opportunity.